used to brighten your own natural teeth without any complications. No removal, cutting, or etching of your dental enamel takes place. Tea, coffee, red wine, tobacco, and the natural aging of the teeth turn them darker or stain them over time. A professional brightening is performed with the aid of active oxygen, which decolorizes the distracting color pigments present in the tooth. In the upper part of the image, you can see the yellowish tooth color prior to the bleaching process. Below, you see the patient after bleaching. First, the gums are covered with a special rubber compound. This is done in order to protect them from the bleaching agent. It's only possible to brighten one's own natural teeth. Crowns, bridges, or veneers can't be bleached. This is one of the reasons why bleaching is the ideal starting point for a ceramic technical provision. After the gums have been covered and the teeth have been dried, the bleaching solution is prepared by mixing two phases, which are then applied to the teeth. Before the bleaching process is started, it's imperative that the dentist perform a check of the teeth and fillings, and, if necessary, a replacement of the fillings, or a professional cleaning. After the appropriate exposure time, the bleaching solution is removed and the teeth are rinsed with water. At this time, the gum protection is removed as well. A professional tooth bleaching may be performed safely every 2 years. Your teeth are just as individual as you are. As you can see in these images, there's no doubt they will become brighter. How much lighter depends on your teeth's base color. Depending on the degree of discoloration, a brightening of about 1 to 14 degrees is possible. The result usually lasts for 1 to 3 years or longer, depending on your own good dental care, as well as regular professional oral hygiene. In cases of heavy consumption of discoloring substances such as alcohol, nicotine, red juices, tea, coffee, cola, red wine, mustard, or ketchup, as well as poor oral hygiene, the result will not last as long. To date, there hasn't been any scientific proof of better bleaching results by exposing teeth to a halogen lamp and/or a laser. Instead, the teeth just dry out more. Although this seems to lead to better results, these results are short-lived, because the effect lasts no more than 1 to 2 days. However, the disadvantage of the lamps is that the teeth could be damaged due to the drying, which is why lamps or lasers are not recommended for use today. The risks of bleaching are insignificant at best. Nevertheless, complications may occur in individual cases, possibly requiring additional measures. And for every additional measure, there may in turn be further complications, which may even lead to the loss of a tooth in the course of treatment. At this point in our discussion, we will only deal with the specific complications encountered in bleaching. These complications are, for instance, sensitive tooth necks, for example in the case of a careless application of the bleaching substance. Toothache, perhaps in the case of leaky fillings. Spotty teeth, which could result from the incomplete covering of the tooth with the bleaching gel. However, all of these complications can be prevented with